We'll talk about another very important test in gynecology. So this is what is known as a Papanicolaou smear. So Papanicolaou smear is also what we call the Pap smear. If you hear them calling about Pap smear, it's just a short form for Papanicolaou. So it's also known as a Pap smear or Pap test. It's a screening procedure you want to dictate to a cervical cancer or any precancerous change in the cervix. Okay, you can see. So they use something to keep the the diameter wide apart. Then they put this brush where they pick up some samples, send it to the lab, to do the smear and observe under the microscope. So primary goal is to basically check if there's any issues with the cervix. Okay. Secondary uses may also be used in identifying infections and inflammation. Okay. So how the test is performed: the healthcare provider uses a speculum. This thing that is used to keep the vaginal wide apart is what is known as a speculum. Please, this image carries a lot of information which you can pause and observe, right? So cells are gently scraped from the cervix using a brush or spatula, but if you are checking for infections or inflammation, you can still go for your target stuff. So it typically begins at age 21. That's people that they should be always going for Pap, smear analysis. So every 3 years, if a woman is between age 21 to 29, every 5 years, if she's between 30 to 65, she should always, go for Pap smear test. Then once she gets 65, she can stop. So result interpretation, sometimes you can see abnormal cells, sometimes you can see normal cells. Do you understand? So if you see abnormal cells, you can now go on for follow-up test where you are doing all those human papilloma virus, colposcopy, and the rest of them.